Thanks, Steph. And that brings us to some of the top stories we are following right now in regards to the coronavirus, counting down from number 3. At least 4 crew members aboard Royal Caribbean's Independence of the Seas have tested positive for COVID. The ship is supposed to set sail from Galveston with passengers on August 15. That brings us to number 2. 4 more residents of the Olympic Village, including 2 athletes, have tested positive for COVID-19. They are now in quarantine. That's a total of 91 people at the Tokyo Games who have tested positive since the beginning of July, bringing us to number 1. New COVID-19 infections in the U.S. have more than tripled over the past month, thanks in part to the spread of that more contagious Delta variant. One of the worst case spikes is in Louisiana, but now there's concerns about one of the COVID-19 vaccines.
Yes, researchers worry the Johnson & Johnson vaccine doesn't actually protect you from the Delta variant. Stephanie Whitfield connects the dots.
You may have seen the headline, the Johnson & Johnson vaccine is much less effective against the Delta and Lambda variants. But there's a lot of important information not included in that headline. Let's connect the dots. This was sparked by a study that has been posted but not peer-reviewed or published as a scientific paper. It found the vaccine made by Johnson & Johnson, while effective against the original COVID-19, does not perform as well against its more contagious mutations. But this was based on experiments with blood samples, not real-world performance. Health experts say the findings do reflect what's being observed with the AstraZeneca vaccine, which was engineered like the Johnson & Johnson vaccine. The UK found that AstraZeneca's shot was only 33% effective against the Delta variant. But Johnson & Johnson has pointed to smaller studies showing its one-dose vaccine worked against the troubling variant. So what do you need to know? If you got the J&J shot, you may need another one. The authors of the study say that second shot should probably be one of the mRNA, which means Pfizer or Moderna, while other health experts say this shows that the Johnson & Johnson should be a 2-dose vaccine, not one and done. Connecting the dots, I'm Stephanie Whitfield, KHOU 11 News.